Welcome to the Pureis Ultra Pure CBT Village Bite-sized medical snippets. Common medical topics covered in 2 minutes. Today, the topic is back pain, which will affect around 2/3 of the working population during their working life, and it is the most common cause of absence from work. It's pretty difficult to cover back pain in 2 minutes, but I will try. Early in my medical career, I was anaesthetising for a very well-respected orthopaedic surgeon at Cheltenham General Hospital. He suggested all patients presenting to their GPs with back pain should be referred to a hospital for assessment and a proper diagnosis. On becoming a GP myself, it became obvious the hospitals would be overloaded if all back pain was referred to them. He was correct in one aspect though, in that the exact diagnosis of back pain is incredibly difficult, and even the use of MRI scans often leads to even more confusion and misdiagnosis. If you use this site regularly, you will soon discover my distaste for MRI scans, but that will appear in another bite-sized medical snippet. In general practice, deciding how to manage patients with back pain is more important than making the exact diagnosis. There are, however, a couple exceptions that I will mention later. Managing back pain broadly falls into 2 categories: those that must rest and those that may gently carry on. You must rest if your back pain has a neurological element to it. That is, the pain radiates into the buttocks, or often down the outside of your leg. This is often sciatica. This type of pain is due to pressure on the nerve, or irritation of it. Exercising or continuing your normal daily activities, including things such as driving or even sitting at a desk, will only irritate the nerve further, causing it to inflame and swell, and hence causing more pain. So those with neurological back pain should take anti-inflammatories such as Brufen, Voltarol, Naproxen, along with analgesics, that's painkillers like paracetamol and codeine, or similar stronger painkillers. But the important thing, they must rest. Mechanical back pain tends to be more central, and this can affect the whole length of the spine. Occasionally it will be one-sided, but this is often due to what's called the sacroiliac joint. The sacroiliac joint is where the whole weight of the body and the trunk lands into the pelvis. The mechanical back pain, you can take anti-inflammatories and muscle relaxants. You may be prescribed something like diazepam to help the muscles relax. But what mechanical back pain means is that you can gently carry on and try to rehabilitate. The 2 exceptions mentioned earlier, which need further medical intervention, is the back pain that is progressive. This is one that continues to get worse despite the above measures taken. This must be investigated, as something more sinister might be underlying the cause of it. The second is neurological pain that is bilateral. That means it affects both sides. It may even affect your bladder or bowels. Or, the other frightening sign for us medics is when people complain of a numbness around the bottom. This needs urgent medical intervention, and when I say urgent, I mean within hours. The reason for not suggesting using analgesics, that is painkillers, with mechanical back pain rehabilitation, is that by taking stronger painkillers, you may end up doing yourself more damage. Generally, paracetamol would be acceptable, but I'd be worried if someone suggested rehabilitating with anything stronger than that. Those of you who have visited the Academy section on the website will know I support and endorse complementary medical techniques, and these do have a major role in managing back pain. But the two categories of pain management that I have suggested, in my opinion, should always be observed. In short, if it's a neurological pain, it needs to be rested. If it's mechanical, you can gently rehabilitate. If you have any questions, don't hesitate to email me or post them in the open forum for general discussion.